Dr. Galbreath, Medical Director of Quality Insurance, Southcentral Foundation.
Hi, I'm Donna Galbreath, Senior Medical Director.
I'm Donna Galbreath, the Senior Medical Director of Quality Assurance at Southcentral Foundation. Southcentral Foundation is an organization that performs healthcare in Alaska. We have 2,300 employees, and we cover health services, including pediatrics, OBGYN, native men's wellness, dental, behavioral health, and substance abuse. We've won the Malcolm Baldrige Quality Award 2 times. We serve 65,000 people, and it's on behalf of these people that I'm speaking. Our service area is Anchorage, the Valley, and numerous rural villages. And it's 100,000 square feet, square miles. So it's the size of Wyoming. Square feet would be nice. We could do that. Size of Wyoming is a little more difficult. So we're really happy to see that some funding increase for Indian Health Service, but there needs to be more. It's estimated that IHS only funds like 1/5 of what it should. So per capita, it's 1/5 of what is funded throughout the nation. The current administration's comments and actions that seek to undermine the sovereign status of tribes really concerns us. So please reject efforts by the administration to eliminate or cut appropriations to Indian health care programs. I wanted to mention the 105L lease programs. These need to be funded, needs to have increased funds, and we recommend that there be a sub-account in the overall budget so that this gets funded, because right now there's movement to not fund this, and it just doesn't work well when things aren't funded. The other piece is that Indian Health Service has a proposal to repeal the fact that they fund hospitals and clinics. And all of you know that if you don't have hospitals and clinics, you can't provide health care. So that doesn't make sense either. Indian Health Service needs to continue to fund these. So this gets to advanced appropriations for Indian Health Service. Again, you guys are well aware that you need to know where your funding is coming from in order to operate a business effectively. And we never know. We don't know what we're getting. We don't know when it's going to be here. And so that isn't an effective use of resources. So what we do is we actually hold some funds in reserves, which isn't effective either. I mean, it works. It's effective for us, and it's effective because we have those shortfalls and because we have the delays in funding. And so that's how we handle that. But those funds could be going into healthcare if we knew when we were going to get the funds from Indian Health Service. So having appropriations that are set is really important in order to effectively deliver healthcare. Otherwise, it affects the quality. Behavioral health programs are also extremely important. There's lots of substance abuse, addiction, and suicide. You've heard a lot about that today. Alaska has the highest overdose rate in 2015, and we've had a marked increase in death because of this, a 500% increase in death. You guys all know the statistics, and you've heard this from many people, but you have to realize that, some of our communities are really small, and you have one suicide in the community, it affects everybody. Not just that family, but everybody in the community, and it reverberates because we are all connected to one another. Even people living in cities are affected by that. So the impact is incredible. Increased funding for substance abuse is really important above and what's been increased for 2019. The opioid crisis is real, and you know that. I know you know that because you've tried to address that. But if you look at the Indian Health Service shortfall in money, and you add the opioid crisis on top of that, it doesn't work very well. It makes the shortfall even greater than what it really is. We really need those funds to get to our youth. This will, if we can have positive impact on our youth and get at the root causes of substance abuse and behavioral health issues, then we can actually have an impact. We have a program called the Pathway Home, and we've served over 1,100 youth in the state of Alaska. And it's great to see them when they graduate because they're so proud. Most of them get their high school diploma through that program, and it's really wonderful to see. I also have to mention contract support costs. I know that there's an indefinite appropriation right now, and I think that's really good. But IHS made this a very complicated process. It was already complicated, but they've complicated more by having increased documentation requirements, and they require 2 appropriations a year to occur. So it's become really complex. So if you could ask Indian Health Service to actually make it simpler to use and user-friendly, that would be really appropriate. Thank you for your time. The Indian Health Service and all the things in healthcare, it's a vast network, and everything is connected to one another. So if you decrease money over here, then it has an impact over here. And that's what Indian Health Service is doing, shifting pots of money. And so overall, it needs to increase. So it's a more functional system. So thank you for your time, and thank you for letting me testify.
Thank you.